All right, so get this. You guys send in some articles about adrenocortical adenomas.
Adenomas.
Yeah, and I know the name sounds like it's straight out of like a medical textbook or something.
Yeah,
But stick with us on this one because this deep dive, it's gonna be a good one.
it is. It is.
Yeah.
And, it might sound scary, but adenomas, they're actually pretty common.
Really?
Oh, yeah. And most of the time, they're totally benign. They're just these little tumors that pop up on your adrenal glands.
So they're just hanging out on your adrenal glands. Like, what are the adrenal glands doing anyway?
Well, they're these small glands that sit right on top of your kidneys.
Okay.
And they're actually pretty important. They make hormones like cortisol, aldosterone, and even some androgens.
Hormones. Okay, so we're talking about the stuff that like regulates stress and blood pressure and all that.
Exactly. Cortisol, it's your main stress hormone. It helps your body deal with like fight or flight
Okay.
situations.
Right. Yeah.
And aldosterone, that helps regulate your blood pressure. It tells your kidneys to hold on to salt and water.
Oh, interesting. And the androgens, those are like the male hormones, right?
Yeah, things like testosterone.
Okay, so these adrenal glands, they're kind of a big deal, even though they're so tiny.
They are. They are. They're like little powerhouses.
So back to these adenomas, you said they're usually benign, but what happens when they're not?
Well, that's when things get interesting. Sometimes these adenomas decide to start producing extra hormones.
Extra hormones, what does that do?
Well, it depends on which hormone they're overproducing.
Okay.
For example, if an adenoma starts pumping out too much cortisol, it can lead to something called Cushing syndrome.
Cushing's syndrome, I've heard of that, but I don't really know what it is.
Basically, it's a condition where you have too much cortisol in your body,
Okay.
and that can cause a whole bunch of symptoms like weight gain, high blood pressure, muscle weakness, and even thinning skin.
Wow, that's a lot.
It is. And then, if you have an adenoma that's producing too much aldosterone, that can lead to primary aldosteronism.
Aldosteronism, what's that one like?
Well, it can cause high blood pressure too,
Okay.
but it can also mess with your potassium levels, make them drop too low.
That doesn't sound good.
Not really. And then, in rare cases, you can have adenomas that produce too many androgens.
The male hormones.
Yep. And that can cause masculinization, even in women.
Wow, so these adenomas can really wreak havoc on your hormones.
They can, if they're the functional kind. Remember, we talked about functional and non-functional adenomas.
Oh, no, right. Functional meaning they're messing with your hormones, and non-functional meaning they're just kind of chilling there.
Exactly. And thankfully, most adenomas are the non-functional kind. They're just these little bumps that don't cause any problems.
Okay, that's good to know.
Yeah. But the functional ones, those are the ones we need to be more concerned about.
So how do you even know if you have one of these adenomas? Do they cause symptoms right away?
That's the tricky part. Sometimes they don't cause any noticeable symptoms for a while, especially if they're small.
So you could have one and not even know it.
Exactly. A lot of times, they're found accidentally during a scan for something else.
So it's like a surprise guest you weren't expecting.
Yeah, kind of. We call those incidentalomas.
Incidentalomas, catchy name.
But even if they don't cause obvious symptoms right away, it doesn't mean they're not doing anything.
Oh.
There's something called subclinical Cushing's syndrome.
Subclinical, so like a milder form of Cushing's?
Exactly. You see, sometimes these adenomas produce a little extra cortisol.
A little extra, okay.
Not enough to cause the full-blown symptoms of Cushing's, but enough to maybe cause some subtle effects over time.
Subtle effects, like what?
Well, it can increase your risk of things like diabetes and heart disease.
So it's like a silent risk factor.
It can be, yeah. And the thing is, it's actually more common than you might think,
Oh, really?
especially in people who have these incidentalomas, the ones found by chance during a scan.
So it's something to be aware of, even if you're not experiencing any obvious symptoms.
Absolutely. It highlights the importance of regular checkups and being proactive about your health.
I'm sensing a theme here. Early detection is key.
It really is. The earlier you catch these things, the better your chances of preventing any serious problems.
That makes sense.
Yeah.
So let's say you do have one of these functional adenomas that's causing problems. What happens then? What are the treatment options?
Well, the first step is to figure out exactly what type of adenoma you have,
Okay.
which hormone it's producing, how much it's producing, and how it's affecting your body.
So lots of tests.
Yeah, there's some blood tests, urine tests, and imaging scans that can help pinpoint the problem.
And once you know what you're dealing with, then you can start talking about treatment.
Right. And there are a couple of main approaches.
Okay, like what?
Well, surgery is often the most effective option.
Surgery, huh? To remove the adenoma?
Yep. If it's causing significant problems, especially with hormones, surgery can be the best way to get things back on track.
But surgery sounds kind of intense.
I mean, any surgery can sound daunting, but the good news is that surgery for these adenomas has come a long way. We're not talking about big open surgeries anymore. These days, it's mostly laparoscopic surgery.
Laparoscopic, what's that?
It's a minimally invasive technique.
Uh,
They make tiny incisions and use cameras and special instruments to do the surgery.
so less cutting, less recovery time.
Exactly. Less pain, too, and shorter hospital stays.
That's good to hear. So laparoscopic surgery is the go-to option.
It is for a lot of cases, especially when the adenoma is causing trouble.
Makes sense.
But it's not always necessary.
Oh, when wouldn't it be necessary?
Well, if the adenoma is small and not causing any hormonal issues, doctors might take a watch-and-wait approach.
Watch and wait. So just keep an eye on it and see what happens.
Yeah, basically. They'll monitor it over time with regular scans to see if it grows or starts acting up.
Okay, so not every adenoma needs immediate action.
Not at all. It really depends on the individual situation.
So if it's small and behaving itself, you might be able to avoid surgery altogether.
Exactly. But if it's large or if it starts showing any suspicious signs, then surgery might be recommended.
Suspicious signs, like what kind of signs?
Well, there's always a small chance that what looks like a benign adenoma could actually be something more serious, like an adrenocortical carcinoma, or ACC for short.
ACC, that sounds a lot scarier.
It is, but it's much rarer than benign adenomas.
Okay, that's good to know. So they're looking for signs that it might be something worse.
Exactly. And size plays a big role in that.
Size? How so?
Adenomas larger than 4 centimeters tend to raise more suspicion.
Oh, okay. So size matters in this case.
It does. It's all about balancing the risks and benefits.
Right. So let's say someone does need surgery for an adenoma. What happens after the surgery? Do they need any special care or medication?
Ah, good question. Sometimes, yes. It depends on how much the adenoma was messing with your hormones.
So if it was pumping out a lot of extra hormones, your body might need some help adjusting
Exactly. You might need hormone replacement therapy for a while.
to make up for what the adenoma was producing.
Exactly. And if you had Cushing syndrome, it can take some time for all the symptoms to go away completely.
Oh, wow. So it's not like an instant fix.
Not always, no. It can take time for your body to rebalance itself.
I can imagine. But the good news is things like high blood pressure and diabetes, they often improve after surgery, right?
Oh yeah, definitely. It can make a big difference.
Okay, so surgery can be a pretty effective solution when it's needed.
It is, it is.
But what about cases where surgery isn't an option right away? Or maybe it's not even needed? What are the alternatives?
Well, that's where medical therapy comes into play. There are medications that can help manage the symptoms and even block those excess hormones.
So it's like putting a temporary brake on those overactive adenomas.
You got it. It's a way to keep those hormones in check until maybe a more permanent solution is possible.
Okay, so it's not always a one-size-fits-all approach. It really depends on the specific type of adenoma and the hormones involved.
Absolutely. Treatment is always tailored to the individual and their specific situation. It's a collaboration between the doctor and the patient to figure out the best way to go.
That makes sense. Now, I'm curious, what about the root cause of these adenomas? Do we know what triggers them in the first place?
Ah, that's the million-dollar question, isn't it?
It is.
And honestly, it's something researchers are still trying to fully understand.
Oh, really?
Yeah, it's complex. It seems to be a combination of factors like genetics, environmental influences, maybe even just age.
So it's not like there's one single cause. It's more like a bunch of things coming together.
Exactly. Like a
Yeah.
puzzle with multiple pieces, and we're still figuring out how they all fit.
So it's a bit of a mystery still.
It is, but that's what makes it so interesting to study, right? We're constantly learning new things.
Well, I'm definitely intrigued. It's amazing how much we still don't know about our own bodies.
I know, right? There's always more to discover.
Well, on that note, I think we've covered a lot of ground already in this deep dive.
Yeah, we have.
We've gone from the basics of what adrenocortical adenomas are to talking about diagnosis and treatment.
Even touched on some of the cutting-edge research.
Exactly. I feel like I've learned a ton already, and I hope our listeners are feeling the same way.
Me too. It's been great breaking down this topic and shedding some light on this often overlooked condition.
Absolutely. And speaking of shedding light, I think it's time for a quick break.
Sounds good to me.
We'll be back in a few minutes to continue our deep dive into the fascinating world of adrenocortical adenomas.
Stay tuned. So before the break, we were talking about the causes of adrenocortical adenomas and how it's still a bit of a mystery.
Yeah, it's like this puzzle, right? We know there are these different factors, but we're still trying to figure out how they all connect.
Exactly. Like, we know genetics play a role.
Okay.
Some people might just be more predisposed to developing these adenomas because of their genes.
So it could run in families.
It can, yeah.
And you mentioned environmental factors too.
Right, right. Things like exposure to certain chemicals or radiation,
Okay.
those could also increase your risk.
Interesting. So it's like a combination of nature and nurture. And then age, you said that's a factor too.
It is. As we get older, our cells are more likely to make mistakes when they divide,
Okay.
and that can sometimes lead to the development of tumors, including adenomas.
So it's like our bodies become a little less efficient at like quality control as we age.
Kinda, yeah.
It's not exactly a comforting thought,
No, not really.
but it's good to be aware of these things.
Definitely. And even though we don't have all the answers about the causes, we do know a lot about how to diagnose and treat these adenomas.
Right. And that's what really matters, isn't it?
Absolutely. Early detection and proper treatment are key to preventing any serious complications.
Now, you mentioned that sometimes these adenomas don't cause any noticeable symptoms for a while.
Yeah, especially the non-functional ones.
Okay.
They can be silent little things, just hanging out and doing their thing.
So how do you even know if you have one? Like, are there any warning signs people should be looking out for?
Well, it can be tricky because the symptoms often depend on which hormone the adenoma is overproducing.
Right, right. We talked about that earlier.
Each hormone kind of has its own signature tune, you know?
Okay, I like that analogy.
So, for example, if an adenoma is pumping out too much cortisol,
Okay.
you might experience some of the classic symptoms of Cushing's syndrome.
Like what? Remind me what those are again?
Well, you might notice weight gain, especially around your midsection and face.
Okay.
You could also develop high blood pressure, muscle weakness, thinning skin.
Right, right.
Some people even experience easy bruising.
Wow, so it can really affect your whole body.
It can, yeah. And then, if an adenoma is overproducing aldosterone,
Aldosterone, that's the one that regulates salt and water, right?
right, so too much aldosterone can lead to high blood pressure,
Of course.
but it can also cause low potassium levels.
And low potassium, that's not good, right?
No, it's not. It can lead to muscle weakness, fatigue, even heart problems.
So that's definitely something you'd want to catch early.
Definitely.
And then there are the androgens.
Right, the male hormones.
What happens if an adenoma is producing too many of those?
Well, it can cause masculinization, even in women.
Like how so?
Well, women might develop increased facial hair, their voice might deepen,
Oh, wow.
their menstrual cycles might become irregular.
So it can really have a big impact on their appearance and their overall health.
It can, yeah. But it's important to remember that not all androgen-producing adenomas cause noticeable symptoms.
Okay.
And in men, the effects might not be as obvious because they already have higher levels of androgens naturally.
Right, right. So if you're experiencing any of these symptoms, what should you do?
See your doctor.
Of course, but what kind of doctor?
Well, your primary care doctor is a good place to start.
Yeah.
They can do some initial tests and maybe refer you to a specialist, like an endocrinologist.
An endocrinologist, that's a hormone doctor.
Exactly. They specialize in diagnosing and treating hormone disorders.
Makes sense. So if you're having any unusual symptoms, especially related to your hormones, it's always a good idea to get checked out.
I can't stress that enough. Early detection is so important.
Absolutely. And now let's talk a bit more about the treatment options. We already touched on surgery.
Right, and laparoscopic surgery is often the go-to option for removing these adenomas.
Okay.
But it's not always necessary, right?
Yeah.
Like if the adenoma is small and not causing any problems.
Right, the watch and wait approach.
Exactly. But even if surgery is needed, it's usually a pretty straightforward procedure.
You mentioned that laparoscopic surgery is minimally invasive, but can you walk us through what that actually means for the patient?
Sure. So instead of making a large incision, the surgeon makes a few tiny incisions, usually in your abdomen.
Okay.
They insert a laparoscope, which is basically a thin tube with a camera on the end,
Okay.
and then they use special instruments to remove the adenoma.
So they can see what they're doing inside your body with the camera.
Exactly. And the recovery time is usually much shorter than with traditional open surgery.
Less pain, less scarring.
Exactly. And most people can go home the same day or the next day.
Wow, that's amazing.
It is. And then there's medical therapy, which involves using medications to manage the symptoms and control the hormone levels.
Right, we talked about that briefly before the break.
Yeah. So, for example, if you have an adenoma that's producing too much aldosterone,
Okay.
You might be prescribed medications that block the effects of aldosterone.
To help lower your blood pressure.
Exactly.
And what about Cushing's syndrome? Are there medications for that?
Yes, there are medications that can block the production of cortisol.
To help bring those hormone levels back down.
Right. And there are also medications that can help manage the symptoms of Cushing's, like high blood pressure and high blood sugar.
So it's really about tailoring the treatment to the individual patient.
It is. Every case is different, and the best treatment approach will depend on a variety of factors.
Like the size of the adenoma, the specific hormones involved.
Right. And the patient's overall health and preferences.
It's a lot to consider.
It is, but it's all part of providing personalized care.
Makes sense. Now I'm curious, are there any new and exciting treatments on the horizon for adrenocortical adenomas?
Ah, that's a great question. And the answer is yes.
Really? Tell me more.
Well, one area that's particularly promising is the development of targeted therapies.
Targeted therapies, what does that mean?
So these are medications that are specifically designed to target the molecular pathways involved in hormone overproduction.
Oh, so instead of just blocking the effects of the hormones, these therapies would actually stop the adenomas from producing them in the first place.
Exactly. It's like going straight to the source of the problem.
That sounds incredible. Are there any specific targeted therapies in development right now?
There are several, actually,
Ah.
and they're showing real promise in clinical trials.
Wow, that's exciting.
It is. And then there are also advancements in surgery.
Okay.
Minimally invasive techniques are becoming even more sophisticated.
So even smaller incisions, faster recovery times.
Yep. And robotic-assisted surgery is becoming more common, too.
Robotic surgery. That sounds futuristic.
It is pretty high-tech, but it allows surgeons to operate with incredible precision.
Wow. So it really feels like we're on the cusp of some major breakthroughs in how we treat these adenomas.
I think so, yeah. It's an exciting time to be in medicine.
It's amazing to think about how far we've come and what the future holds.
I know, right?
Yeah.
The possibilities are endless.
Okay, so we've talked a lot about the different types of adenomas, their symptoms, and the treatment options.
We have.
Is there anything else we should cover before we wrap up this deep dive?
Well, I think we've done a pretty thorough job, wouldn't you say?
I think so, yeah. We've covered a lot of ground. But before we wrap things up, I want to circle back to something we touched on earlier about early detection.
Ah, yes. Always important.
So important. If you're experiencing any of the symptoms we talked about, whether it's weight gain, high blood pressure, muscle weakness, any of that,
Right.
it's crucial to talk to your doctor.
Absolutely. They can help you figure out what's going on and recommend the best course of action.
Exactly. And the earlier you catch these things, the better,
Right.
right?
Oh, absolutely. Early detection is key to managing these adenomas and preventing complications.
It's all about being proactive,
It is.
taking charge of your health.
Couldn't agree more.
And remember, this deep dive, it's just a starting point.
A glimpse into the world of adenomas.
Exactly. If this has piqued your interest, do your own research, talk to your doctor, learn as much as you can.
Knowledge is power, right?
Absolutely. The more you know about your body, the better equipped you'll be to make informed decisions about your health.
Well said.
Well, on that note, I think it's time to wrap up this deep dive.
Sounds good to me.
It's been a pleasure exploring this topic with you.
Likewise. Always a good time.
And to our listeners, thanks for joining us on this journey.
Yeah, thanks for listening.
Remember, you're not alone in this.
We're all in this together.
Stay informed, stay curious, and most importantly, stay hopeful.
Here's to good health.
Cheers to that.